you're effectively dealing with the vision correction at a convenient part of the day. You're putting these lenses in just before you go to bed. You go to sleep, you wake up, you wash your hands, you take them out, and then you just get on with your day. You're seeing clearly, and there's no more fuss, other than just once you take them out, you need to clean them, but that's not an arduous task.
Right. And I guess if you're somebody who enjoys water sports, if you're into surfing, even swimming, it's not a good idea to wear traditional contact lenses while you are in the water. So is that something else that you think is in the plus column for Ortho-K?
Yeah, so I mean, if you have a look at what are the risks of going in doing a water activity with a contact lens, is the contact lens has a way of attracting and having the bacteria or the other bugs that create or increase your risk of infections kind of stick to the contact lens, and so they're being held there, and so there's more opportunity for that bacteria or that bug or bacteria or germ to actually create an infection. Obviously, with Ortho-K, you don't have something in your eye, so you're not attracting extra. You don't have something there that's going to hang on to those pathogens.
Yeah, there's some pretty nasty like parasites, I think, that can be introduced by wearing contact lenses in water.
Yeah, acanthamoeba amoeba is the big one that we worry about with water introduction, and that's something we counsel people on with their Ortho-K lenses. You need to make sure that you're not sort of using water with your Ortho-K lens, that you're using the appropriate products. But yeah, we have the advantage of you're not wearing them while you're doing a water activity.
So are there any types of like professions or job roles where you think Ortho-K might be a good option? Like I'm thinking, maybe people who are working in dusty or windy environments where, traditional contact lenses, there would be additional challenges there.
Yeah, and that's the challenge of contact lens, where that, like attracting pathogens while you're in water with them on, you can get dust and those sorts of things caught underneath them in those sort of dusty environments.
So for people who, have had problems with dry eyes in the past, so Ortho-K would be a good option for them, you think?
Yeah, so if you're someone where your dryness symptoms mostly only occur when you put a contact lens on, that puts you in that kind of borderline dry eye category. And so we're assuming that if we've looked at your eye and your cornea is intact and we're not seeing sort of active major issues with dry eye we need to resolve, you don't get those contact lens related dryness symptoms with an Ortho-K lens, because you're going to be asleep while you're wearing it.
That's right. Okay, well, so we've been talking about Ortho-K for adults, but it's kind of ironic, I think, that although orthokeratology was maybe originally experimented with as an adult vision solution, there is a lot of clinical evidence now that it's a really good option for reducing myopia with children, isn't it?
Yeah, look, it's considered one of the top, because it's got so much research behind it. It was one of the treatments that really led the charge in myopia control. And being a relatively early adopter, I remember the local orthokeratology sort of society. There was probably less than a hundred of us in Australia and New Zealand practicing in that way. And at that time, it was, as you said, mostly an adult correction that was marketed as an alternative to laser surgery, an alternative to daytime contact lenses, and obviously an alternative to wearing glasses. And as we all gained more experience and the industry was able to help us provide faster results, more consistent results, then we got more comfortable fitting younger people with it. And then a lot of the practitioners were sort of observing and saying, hey, you noticed that the young people that we fit this with their prescriptions don't change nearly as much as when they were in regular contact lenses and regular glasses. And that caught the interest of local researchers. And so a big part of what we see in the world now for myopia research was really driven out of Australia, and Ortho-K was right there at the beginning, in the early part of that. And so it remains one of the best researched. If you have a look at from a myopia control point of view, there are a lot of ones that are all on an even par, but Ortho-K just happens to have the test of time. And if you look at any adjunct therapy where you might be using multiple therapies to really, if someone who is a rapid progressor and you're wanting to sort of double up the treatment, so you're using two different strategies, then Ortho-K is one of the ones with the strongest adjunct therapy research behind it. It's front and center. So you're doing Ortho-K plus you're doing something else.
Whether you're talking about, for example, like atropine drops, are you?
Yeah, and red light therapy now, which is something, as we were speaking earlier off camera, that we're introducing into the practice very, very soon. And so there's a very strong result when you use it as an adjunct therapy with Ortho-K.
Okay. Well, maybe watch this space on that one, I think, because I think you probably want to talk more about that next time in the near future.
Yep, just need to get a little bit more seat of the pants experience with it and get all our protocols in place. But yes, no, it's an exciting time to be able to introduce that in addition to the Ortho-K that we're already offering.